Hi, I'm Dr. Rizwanullah. Welcome to this introductory lecture on Introduction to Medical Abbreviations. So let's begin. In this lecture, we will discuss what are medical abbreviations, what are the advantages of using medical abbreviations, what are the risks associated with the use of medical abbreviations, and the best practices for using medical abbreviations to avoid these risks. And last, I'll provide you some additional resources related with this lecture. So the medical abbreviations, these are basically the shorthand notations that streamline communication and documentation in the healthcare settings. So these medical abbreviations, they condense complex medical terminology into concise symbol or acronyms such as CBC, calcium, and DNA. Other examples are A and E, like accident and emergency. BP means blood pressure. CNS means culture and sensitivity. So these are few examples of the medical abbreviations. Now, what are the advantages of using medical abbreviations? So the medical abbreviations, basically they save time and space in the medical records. Therefore, they provide efficient record keeping. They promote effective communication among healthcare professionals as well. Now, the medical abbreviations, they also have risk associated with their use. For example, a risk of misinterpretation or misunderstanding. For example, Mg, the capital M and smaller g, it means magnesium, but sometimes there's a confusion between Mg and the smaller mg, which means milligram. The medical abbreviations like RA, sometimes it can create some confusion if the context is not clear. For example, RA, it means rheumatoid arthritis, and RA also mean research assistant. So it is very important that one should know the context that is used within a when a medical abbreviation it is used. To avoid these risks, what are the best practices that should be used? The medical abbreviations, they should only be used in appropriate context. For example, it should be used among the healthcare professionals and not for the patient communication. Secondly, the medical abbreviations, they should be avoided in all patient-facing documents. Means the instructions that are given to the patient or handouts that are given to the patient. In those documents, the abbreviations, they should be avoided, especially with unclear contexts. The medical abbreviations, the verification and clarity is also very important. If you came across ambiguous medical abbreviation, it is very important to double check what is the meaning of these abbreviations, and always follow your institutional guidelines regarding the use of medical abbreviations to avoid any error. So there are some additional resources that are available with this video lecture as a downloadable resource. The first is the Joint Commissions do not use list. So these abbreviations, they should be avoided. The second one is Institute for Safe Medication Practices recommendation for the use of medical abbreviations. So it provides you a list of medical abbreviations that should be avoided in the healthcare settings because of a chance of confusion. So thank you very much for watching this lecture.